Good afternoon, everyone. I am Dr. Manisha Tarpalikar from IIP Digital Media team. I will be the host for today's webinar. Today's webinar is conducted by Tamil Nadu's IIPWC Tamil Nadu branch. In view of the World Physiotherapy Day celebration, they are conducting this webinar series. This is day 5 of the webinar series. The webinar's topic for today is Frailty to Fitness, Promoting Health, Healthy Aging Through Movement by Dr. Lakshmi Prasanna. The Indian Association of Physiotherapists is the oldest and the largest association representing physiotherapists in India since 1955. The IIP Digital Media team consists of a group of physiotherapists who handle Zoom platforms, webinar lives, streaming, and IIP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, YouTube, etc. Follow IIP profiles on these social medias to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drives, and to know about the recent updates on physiotherapy. Subscribe to the IIP YouTube channel for notifications of our live webinars. In the playlist section, webinars are segregated into various folders on topics like orthopedics, neurology, sports, fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for easy access. These social media links will be shared shortly. Over to you, Dr. Kavita, to continue with the session. Thank you.
Thank you, Dr. Manisha ma'am. Good afternoon, everyone, and thank you for joining us today for our Day 5 webinar series for celebrating World Physiotherapy Day 2025. I, Dr. Kavita, absolutely honored to be the moderator of today's session. We have a fantastic speaker today who will share their knowledge with us. Without any further delay, I would like to introduce Dr. Lakshmi Prasanna, a compassionate physiotherapist with a Master of Physiotherapy degree specializing in neurological and psychosomatic disorder from Father Muller Medical College and Hospital, affiliating with Rajiv Gandhi University of Health Science, possessing solid academic foundations and practical expertise. She has extensive experience managing a broad spectrum of patient populations, including pediatric, adult, geriatric, neurological, orthopedic, and sports rehabilitation cases. Professionally, she served as a lecturer and clinical physiotherapist at Akash Institute of Medical Science and Research Center, Bangalore, for 3 years, and Savita College of Physiotherapy for 2 years, where she instructed Bachelor of Physiotherapy students and managed complex clinical caseloads. Since May 2023, she has been the consultant physiotherapist and head of clinic at Reagan Physiocare, currently working as assistant professor at Viswa Mahavidyalaya University at Kanchipuram. Lakshmi Prasanna ma'am actively contributes to physiotherapy research with multiple peer-reviewed publications on topics such as muscle fatigue, fibromyalgia management, and occupational nerve tension. She has presented research at national conference and continually upgrades her skills with certifications in soft tissue manual therapy, aquatic therapy, fitness training, CPR, and neuro rehabilitation. Over to you, ma'am.
Good afternoon, ma'am. Good afternoon, everybody. Many thanks for great introduction, ma'am. I'm very delighted to be here. And firstly, I would like to extend my heartfelt gratitude to each and every member in the IAP Women's Cell, the president, secretary, joint coordinators, and head of the coordinators, all the members of the team. A very uh, heartfelt gratitude for providing us an opportunity to serve as a resource person and providing everybody a platform as a to share all the insightful knowledge on the occasion of World Physiotherapy Day. So I feel very delighted and honored to be here. So I welcome you all for. I'm sharing my screen. Is it visible?
Yes, it will come in a while.
Yes. So I welcome you all to my presentation from frailty to fitness, promoting healthy aging through movement. So that is with the help of exercise. Okay. So this is the topic we are going to discuss today. So in this topic, we are going to explore so what is healthy aging and what is frailty and the underlying mechanisms, how the frailty is being caused. Okay. So how the people, older aged people are getting affected with this particular condition, frailty, and how we can identify and manage with the different types of approaches along with some evidence-based strategies and a little more about the government initiatives that has taken for benefiting the mainly this elderly age group people. So okay, these are the things we are going to explore in this today's session of webinar series. So firstly, healthy aging. Okay, so the WHO, World Health Organization, it is 1 second, I'll minimize. Yes, so the WHO in the year 2024, it has clearly defined healthy aging. It is a process of developing and maintaining functional ability. So which means a person, in order to say he or she is functionally able, so she or he has to be, an elderly population has to be so physically good, mentally good, and socially also good. So in order to say he is functionally able, okay. So how we calculate that? Because of based on, there are certain criteria. So if a person is meeting all those criteria, we can say that so a person is functionally able, functional ability is good, okay. So those criteria includes the basic needs. So individual, the older aged people has to meet, has to do their own work, activities of daily living, okay. They should not depend on others for most of the things, okay, like eating, going to bathroom. So these are the small things. They has to be very much independent, okay. So and they has the ability to learn and grow and be mobile. So it has to move from at least from bathroom to bedroom to little more shops beside, which is located side to the house or home. And a person should be able to build relationship with one another. At the same time, he has to be, in whatever way possible, he has to contribute to the society, okay. So generally speaking, so when we have a conversation with our parents or relatives, so they will be saying that so my grandparents has lived for 100 long years, my grandparents also people has lived for 99 years, so like that. So it doesn't mean so that person is functionally able. So you would have been on bedridden for 5-6 years, but still you would have been lived for 100 years or 101 years or 1 or 2 years, whatever the age, okay. So the God has gifted to them. So it doesn't mean the, it doesn't mean he is functionally able, okay. So it does. So what I am going to explain is, so the functional ability is does not depend on the number of years, the number of years a person has lived. So it completely depends on so how long a person has been independent, okay. So a person is doing all his activities without depending on others, okay. So based on that only, the Health Organization has given a very nice statement that so in order to say a person is healthily aged, so he has to maintain or he has to have some amount of functional abilities. Clear? Yes, next coming to the understanding frailty. So we have to know what exactly the frailty is. So it is actually a clinical syndrome. It is actually a clinical condition which involves multiple systems, okay, which involves multiple organs, okay. So we cannot say the aging, elderly aged and frailty is same, okay. So there is a very much difference between normal aging, disability and frailty, okay. So here when we are talking about the frailty, so it is a multi-system dysfunction, okay. So it, because it involves various systems, various organs in the body, okay. So there, by the involvement of various organs, there is a decreased physiological reserve. So physiological reserve means, so when we are talking about the young people, younger generations, okay. So even when we don't eat breakfast or lunch for one day, so we are able to cope up with the activities that is there for us for the entire day for 24 hours. Okay, so that is the energy which is already been stored in so and so in young people. Okay, so that is the reserve, the capacity or the amount of energy which is already been there. Okay, so whereas here when we are talking about frailty, so there is a decrease in physiological reserve. Okay, so the amount of function, the physiological normal physiological functions or mechanisms of different organs like heart or lungs or musculoskeletal system, so many things, the physiological reserve itself is reduced. Okay, so which is making them prone to much more vulnerability. So vulnerability is nothing but prone to get more infections. Okay, they has less ability to cope up with stressors is nothing but the injuries or any illness or fever or simple fever or any fall related injuries. All these are stresses. Okay, they can't even tolerate even the mild stresses. They can't they won't be able to tolerate. Okay, which means their vulnerability is more because of reduced physiological reserve. Okay, so it is distinct from normal aging and disability and involves multi-system decline. So which means, so there is a difference between normal aging, disability and frailty. Okay, so in normal aging, so when we say frailty and normal aging, so when we look at the people who are elderly age group around us, so they always be complaining. So I'm feeling tired, I'm feeling not able to go out, not so and so complaints. Okay, so they will also have similar symptoms which is same as frailty, but we cannot say frailty and normal aging is same. Okay, there is a difference. Okay, so when we are talking about normal aging, okay, so there is a slowdown of process, there is a slowdown of normal physiological process, but it is limited to one organ, it is limited to one system. Okay, so but when we are discussing about frailty, it is a multi-system involvement. Okay, so if the person has history of amputation, he cannot walk. Okay, if a person has eye problems, he cannot see, that is how his mobility is reduced. Okay, so one particular area a person is having disability, reduced in mobility because of so and so particular reason which is affecting one or two functions, whereas frailty it is not same. Okay, so it is a gradual slowdown of various organs systems. Okay, it is affecting multiple organ systems. Okay, slowdown of process of multiple organ systems. Okay, so because of multi organ involvement, okay, so the person is feeling the weight loss or exhaustion or weakness or slow walking speed and low physical activity, all this because of not only one problem. So okay, even for a normal aging population will also have the similar symptoms. Okay, so but it can be because of Parkinson's, you can see most of the cases, you can see all these symptoms. Okay, we cannot conclude he is fragile. Okay, we cannot conclude he falls under frailty category. Okay, so because we have to say, we have to come to conclusion of frailty elderly aged population if there is a multi-system involvement. Okay, so next talking about the disability. Disability, we all know there is a loss of some amount of limitation. Okay, because of so and so reason. If it is a stroke condition, a cerebrovascular accident, so a person will be having hemiparesis, one side weakness. Okay, so partial movement or complete movement based on the type of injury. Okay, so he is not able to be compete with the other normal peer group. Okay, so because of he is having cerebrovascular accident, some amount of neurological problem. Okay, so that is disability. Okay, so I hope now everybody is clear about the difference between normal healthy aging and frailty and disability. Okay, so frailty is nothing but it is a multi-system involvement. Okay, which is causing decreased physiological reserve. Okay, whatever the normal physiological functions of every organ, so it itself is getting reduced. Okay, which is leading to increased vulnerability, means which is susceptible, the elderly people are susceptible to more stressors is nothing but feeling illness. Okay, feeling sick because of infections or any injuries, or even for a simple cold or fever also, a person would not be able to cope up or recover back completely. Okay, so that the healing capacity or healing power will be reduced. Okay, so next is commonly identified the frailty. Most of the common symptoms include weight loss, exhaustion, weakness, as we discussed before, slow walking speed and low physical activity. So identification of frailty or at risk and management constitutes a cornerstone of rehabilitation, mainly geriatric rehabilitation. Okay, because the prevalence is more. Okay, so that is why identifying this and identifying different evidence-based treatment approaches is very much important. Okay, when we see at the epidemiology of frailty, so the prevalence increases with age. So approximately as we get older, as we get older, approximately 7 to 10 out of 100 individuals in the community dwelling adults over the age of 65 is 7 to 10%, which means 7 to 10 out of 100 are getting affected. Okay, which means are frail. Okay, so as their age is more, so from 65 to 85, as they reach more, okay, as the age is getting more high in number, so again the percentage 25 to 50 out of 100 individuals are getting affected. So it is given in the study Collard et al. 2012. So he has said 7 to 10 community dwelling adults in every 100 people are frail, who are aged only 65 and above. But when they reach 85, so it is getting triple the amount, like 25 to 50 out of 100 is very much like half and half. So since the prevalence is very much high, so identification and creating a treatment strategies for this kind of population is very much needed right now. So frailty is more common when compared to the men and women are more affected with frailty than compared to men, and those with chronic disease and low socioeconomic status are much more affected. Okay, so when we look into the gender basis, women are more commonly affected. Okay, so and when we look at the that also with the chronic disease background, so who are affected with multiple comorbidities and underlying chronic disease, and those who are taking polypharmacy and much more medications for different conditions like diabetes or hypertension or any other condition, underlying medical conditions, they are more prone to get frailty. And people who are living in low socioeconomic status, who don't have much knowledge or much awareness about the healthcare systems, those who doesn't have much financial status, don't have much amount of money to go to the hospitals to see the symptoms, all those management and take the proper management, so those category of people have much more prevalent for frailty. Okay, so growing health burden due to aging population globally. This is not it will get affected only 2025 or 2026. No, it is growing thing. So growing public burden will be also more. So in order to prevent that, in order to break this cycle, we have to have certain amount of knowledge regarding this condition. At the same time, you have to know how to treat and manage the population. So this is the study which is published in 2019 in the journal Aging Clinical and Experimental Research. They have done a study. So this is not in India, this is in the Norway. So but the statistics won't be much differs from here and there. So they have done in 2019, and they have suspected, they have predicted, okay, so how it will be in the year 2023, which is gone, 2030 and 2040. Okay, so when we see this, the green is the frailty thing, and this one is the predicted, estimated in the future. Okay, so 2030 how it will be, 2040 how it will be. When we see in the 2040, from 2.12 it is reaching to 7.3. Okay, it is 5 times more. Okay, right, it is double or triple the time from now to then. Okay, which means they have estimated this based on population statistics. Okay, based on the population data, they have estimated the frailty will rise from 2.1 to 7.3 in the year 2040. So which is 3.5 times more than now current situation. Okay, so the burden is really high, and knowing and underlying causes and treatment and identification strategies is very much important. So next is biological and physiological mechanisms. So what exactly causing the frailty? So as we discussed before, it is multi-system dysregulation. Okay, so involvement of multiple systems, multiple organs. Okay, so involvement of multiple organs means It can be your musculoskeletal system, it can be your nervous system, it can be your brain, it can be your lungs, it can be anything. So it is involvement of multiple, okay, so multiple systems. Okay, mainly the first important thing that is leading to frailty is sarcopenia, so which is nothing but the loss of muscle mass and strength. So the other most common thing that is leading to frailty is chronic inflammation. These are the some main physiological things which is leading to frailty. Okay, one is sarcopenia, second one is chronic inflammation, next is hormonal imbalance, and the fourth one is oxidative damage. Okay, so sarcopenia is nothing but the loss of muscle mass and strength. Okay, because of, as we know, in the normal aging process itself, the amount of muscle mass when compared to younger adults is getting reduced. Okay, because of the main thing they have identified is because of malnutrition. Okay, there is always a link between sarcopenia and malnutrition or chronic malnutrition. Okay, so which is underrated statement, but still that is the main underlying cause that is leading to sarcopenia. And in frailty is, this is the most important mechanism that leading to multi-system dysregulation, which is directly causing your frailty. Okay, so as I told, it is a complex and multi-system involvement. Okay, so that means various systems are getting involved. Okay, so here the functional loss. Okay, what are the functional loss? If there is a loss of muscle mass and muscle strength, what does a patient will feel? What does the elderly people will do? Okay, so slowly the muscle strength is getting reduced. Okay, the patient or the older individual might not actually feel I am weak. Okay, but still you in their activities, in their daily routine, in their daily activities, you can see. Okay, so either in the speed, or if the person, if the elderly age individual is able to lift 5 kgs before, so slowly he is not able to lift 5 kgs and he has moved to 3 kgs or 4 kgs or 2 kgs. Okay, like that. Okay, like that the strength is slowly gradually reducing. Okay, the next most important is chronic inflammation. Okay, so chronic inflammation is nothing but, there is always in the normal aging itself, there is always a low level of inflammation that is been there. Okay, it is based on the articles, it is not my own sentence. But when we are talking about frailty, because of persistent inflammation that is present in the body, it is slowly disturbing the internal environment. Okay, so this inflammation starts from cell. Okay, cell, we all know the functional unit of our living body, right? So living organism, so even the small cell is getting affected. So group of cells is nothing but tissue, that tissue is forming organ is forming organ system. Okay, likewise. Okay, so when there is a damage in the cell, so slowly it is getting affected the tissue and organ level and system level. The hierarchy is getting, the entire environment is getting disturbed. So what does this mean? Okay, so the reserve, what we talked before, okay, the reserve, the capacity to heal, repair, okay, from any disease, okay, from any illness or from any ongoing medical condition, the ability to repair is reduced. Okay, which means the impairing capacity to heal has come very much down. Okay, so that is because of existing chronic inflammation. Okay, next one is hormonal changes. Okay, hormonal imbalance. Okay, so we have testosterone, growth hormone, estrogen and progesterone. There are various hormones which are helpful for maintaining the normal metabolism, normal physiological functions. Correct. So here, there is a changes here. So when the amount of hormones are produced less in number, less in quantity, so the body metabolism is already coming down. Okay, so all the regulations are being disturbed. Okay, so that is how the physical ability is also reduced. So next is the oxidative damage. Okay, the oxidative damage is nothing but the amount of free radicals as we is getting deposited much and more. Okay, so that is how it is leading to disturbing the all the physiological mechanism in the body. Okay, so all together we call it as multi-system dysregulations. Okay, so as the person is growing older, there is so much of already slowdown of normal physiological functions happen in normal aging itself. But here in frailty, there is a dysregulation that also happens much more. Okay, so the various reasons is sarcopenia, chronic inflammation, hormonal imbalance, and oxidative damage. Okay, all these changes reduce the ability to respond to stress, and as we discussed, repair and recover. Next is muscle deterioration, impairs mobility, balance, and energy expenditure. So the outcome of all these physiological mechanisms is nothing but so that affects your movement, that affects your mobility, that affects your flexibility, that affects your strength, endurance, balance, and energy expenditure, right? So it doesn't affect only one system. Okay, it affects multiple system. Okay, so the physiological background of frailty. So the main thing, okay, the main thing which is underrated is chronic undernutrition. Okay, a chronic malnutrition, okay, which is causing your sarcopenia, and sarcopenia is because of loss of muscle, and that is reducing the resting metabolic rate. So further, in order to cope up with the daily activities, okay, so more amount of energy expenditure is required, that also being reduced in the elderly age people. Okay, so this chronic undernutrition is because of age. Okay, one is age factor. The other one is already malnutrition because of socioeconomic status. Okay, or because of no children or caretakers at the home, or with the financially background is not stable, or environmental factors. All this might lead to chronic undernutrition. Okay, so there are other characters which we discussed before, like dysregulation in the hormones, inflammation, and coagulation. Okay, so coagulation, how it is causing sarcopenia. Okay, so as we discussed, there is a muscle loss in the sarcopenia, loss of muscle mass. Okay, the muscle cells are getting getting injured or getting died, the cells in the muscles are getting died, means the muscle has, for the help of contraction, it has some amount of proteins. When the muscle cell is getting destroyed, the muscle proteins, okay, are getting dissolved in the blood flow. Okay, so that itself causes clots in the blood formation. That is how it is linked with the sarcopenia. Okay, right? So all these factors will be seen in reduced strength or muscle power, or reduced walking speed and physical activity. So overall, the independence of an elderly individual is getting reduced. Next is risk factors. Okay, so when we see at the risk factors of the frailty, there are various. Okay, one is intrinsic, classified as intrinsic risk factors, and extrinsic risk factors. Okay, so when we see the intrinsic risk factors, it is of mainly two types. Okay, so one is age related, and second one is disease related. Sorry. Okay, so age related, mainly the most common risk factors I have listed down here. Okay, so visual, neurological, and musculoskeletal changes. Okay, so coming to the visual changes, the first one is glare intolerance. Okay, so all this mainly the frailty, okay, so is causing reduced mobility. Okay, reduced mobility, if the person has already reduced mobility and he has to do so and so activities in the home, okay, is not able to cope up. Okay, and there is a certain other character which leads to falls. Okay, so the main symptom that can be seen in frail individuals, frailty affected individuals, are falls. Okay, so there is another factors that is causing in visual system changes are, so glare intolerance, or altered depth perception, we cannot see, okay, distance. Okay, so even if it is near, the elderly population cannot judge the distance between the item and your eyes hand level. Okay, so that the perception distances will be there. Okay, other thing is neurological function. Okay, already there is a slow conduction which is leading to slow reaction times. Okay, so next there is a decreased sensory awareness. Okay, the proprioception and the vibratory senses, all this. Okay, temperature, touch to light touch or sensation, all this, fine touch, all this, and temperature are getting slowed down. Okay, because of all this, a person is not able to deal with the everyday activities. Okay, so next is there is a musculoskeletal system system related risk factors. Okay, so the main things that is affecting in musculoskeletal system is, as we age, there is a reduced amount of range of motion, flexibility, muscle strength, and muscle power. So all these factors are contributing to your reduced physical mobility. Okay, next is disease related or medical problem related. So first is neurological. So all these systems, so whatever most of the conditions, so frailty is not something. So if you have diabetes, you will get frailty. Okay, if you have stroke, you will get frailty. Okay, so whatever systems we have in our body, so all together will contribute to frailty. Okay, so even if the person is having neurological, so as I told before, it is involvement of multiple systems. Okay, so the underlying causes can be anything. Okay, so if stroke is affecting your nervous system, if arthritis is affecting your musculoskeletal system, and if your so clots in the cardiovascular status is not so good, okay, in the patient at the same time has constipation problems at the same time, because of all this is having a socially and mentally is not stable, okay, we can conclude them as a frailty. Okay, it is not something, so we cannot conclude if the person is having one system disorder, he is having frailty. It is not that. Okay, it is a combination of multiple factors. Okay, it can be any of the medical condition that is leading to frailty. And there are certain extrinsic factors, okay, that is not related to internal physiological mechanisms. Okay, so whatever we discussed in the intrinsic factors, that is age related and disease related, all this will disturb the physiological mechanisms. Okay, so that is how it is leading to frailty. When we are talking about the extrinsic risk factors, okay, so over time taking of certain risks, okay, depending on polypharmacy, okay, certain, so that is the age group. Okay, so person might have common comorbidities, certain conditions, so any of this listed in disease related. Okay, so it might have for long term, like 20 years, 10 years, 15 years, and depending on the same medication, without which you won't be able to survive. Okay, these factors also might lead to, will make the patient dependent. Okay, will make the patient slow down. Okay, so and the environmental factors will also contribute to frailty. Okay, so these extrinsic factors will not directly contribute to frailty, but whatever the physical ability that is reduced because of frailty will contribute to that. Okay, so if the physical ability is reduced to 70% because of all these extrinsic factors, it might be up to 80 to 85%. Okay, so these are like add-on problems to intrinsic risk factors. That is how we can come to conclusion. Next is consequences. So okay, so consequences of frailty. So mainly, so if you're elderly aged people affected with frailty, so the one first and foremost thing is, so the risk of falls is more, because whatever we have seen in the frailty, it is reduced strength or weight loss, exertion weakness, slowed walking speed, and low physical activity. So all this will contribute to risk of falls, the number of hospital admissions, and disability, institutionalized. So he needs one. So elderly people might need be taken care of in a special elderly age homes, or which is been hospitalized for long term. Okay, and sometimes in severe cases it is mortality. Okay, next, it doesn't only affect the physical functions, but it also affects psychologically. Okay, so whoever is affected with frailty for a long time, okay, so they might go for depression, anxiety, and social isolation. Okay, so which overall leads to reduction in independence and quality of life. Okay, so falls, risk of falls and number of hospital admissions will get more. Okay, which means financial also, it is not cheaper. Okay, it is costing you, this certain condition is costing you, and it is leading to disability, which means you have to be dependent on others to do your activities and institute, which means so long care has to be done in nursing homes. So next is identifying frailty in clinical practice. So which means, so since it is a multi-system involvement, okay, we cannot assess only one part and send the patients back. Okay, so multiple system examination has to be done. Okay, so all the risk factors we have discussed here. So in the risk factors itself, we have listed all the system: musculoskeletal, neurological, visual, cardiovascular, psychological, all the systems. So all the systems we are going to examine. Okay, so first one is visual impairment. Okay, so visual impairment is if you want to give exercise, if the patient is complaining, not able to walk, you have to see all this, you have to examine all this, and so that you will know the underlying cause. Okay, what is limiting the physical ability. Okay, so to get that information, you have to assess all this. First one is visual impairment. How do you assess? By visual, checking the visual field. Okay, right, visual acuity, Snellen chart, all those you can see. Next is cognitive impairment. The basic individuals, like memory status or thinking ability, or the person reaction time, how he is able to respond to the asked question. Okay, all this cognitive, how good he is cognitively, how good his higher mental functions are working, so how good his memory is. Okay, to check all those, okay, you have to assess the cognitive impairment. Next is neurological examination. So this we get the reflex assessment, and then you can check for the sensation. Okay, and you can check for the examination and observation, is there any focal impairment, okay, focal weakness. Okay, so all this can be gathered by neurological examination. Okay, so next is cardiovascular examination. Is there any arrhythmias, is there any changes in the pulses? Okay, if there is any existing cardiovascular conditions and what medications he is on, you can go on. You can get all this, most of the information from the history of the patient itself. Okay, so next is assessment of gait, balance and mobility and muscle weaknesses. Okay, you can simply process with the, since we have so many systems to examine, you can take each one outcome measure for each and everything, which can be doable at the same time, which is less time consuming. Okay, because we are going to deal with the elderly population. Okay, their tendency and their availability and their ability to cope up with the all the examination process will be very much shorter. Okay, so according to that, you have to frame the assessment and treatment protocol. Okay, so gait, balance and mobility and muscle strength, you can go for simple bedside tests like grip strength. Okay, and mobility is, there is a composite physical function scale that you can use. Okay, which has like self questionnaire. Okay, which has various questions the patient will be doing in day-to-day life. All those activities will be listed, like it is a sort of 14 question. Okay, you can ask and get the information. Next is balance, Berg balance scale you can use. Next is gait. Okay, simple uh, sit and reach, sorry, gait balance, you can dynamic gait assessment skill you can be used. Okay, all the simple. Okay, so you can use and assess and come to conclusion at what level of ability the patient falls under. Okay, next is assessment of osteoporosis risk. Okay, because mainly, okay, in the elderly age group, okay, so the physical activity is reduced. Okay, so we want to make them move. Okay, so if the bones are very weak, okay, the therapist, whoever is giving prescription, will falls under risk. Okay, so in order to prevent that, we have to check for osteoporosis risk. There is a FRAX score. Okay, we cannot completely do this. Okay, so it has to be under uh, orthopedic doctor. Okay, it is based on the scan, DEXA scan. We will come to a conclusion. Okay, so it gives the information exactly the prediction of 10 years, next 10 years. Okay, so if there is a weakness in the spine, if there is a weakness, I mean the bone density is lesser in the spine and the lower extremities and upper extremity, that data it will give. Okay, FRAX score. Okay, next is assessment of urinary incontinence. This is very much important. Okay, because the patient has to move from one place to another. Okay, so it is a completely dependable activity. Okay, so think about 80 plus year of aged population. Okay, so this is independent only for some category of people, but most of the individuals required assistance. Okay, so either physically or through with the help of certain environmental equipments or moving things. Okay, so which means it is completely dependable. Okay, so assessment of urinary continence or bladder control, void control, which we can see mostly in neurological conditions. Next is assessment of home hazards. Okay, so is there proper ventilation, proper lighting, is the floor is safe enough for the patient to move? patient to move, okay, to go out from the bed, from one room to another room, from bedroom to kitchen, to do his daily activities, and the type of carpet, all this we have to have a check. Next one is there are certain tools, okay, that we can exclusively for frailty. Okay, one is frail phenotype, frail scale, and clinical frailty scale for easy screening. Okay, so these are not very tough. Okay, they have given a certain criteria. Okay, if a person falls under this criteria, we can conclude the patient is the elderly aged so and so person is frail, falls under frailty. Okay, so this is a frail screening tool. Okay, so it says only the frail, okay, whether the patient is fatigue, okay, are you fatigue, we are going to ask. Okay, so it is self-directed, self-reported answer. Okay, next is resistant. Can a patient walk up to one flight of stairs? Okay, one side of stairs, like 6 to 10 amount of stairs, that the patient can walk or not. Okay, so which gives resistance in the lower extremities. Okay, which says the patient is good enough, okay, in terms of musculoskeletal system and in terms of your cardiorespiratory endurance. Okay, so next is aerobic. Okay, can a patient walk on one block? Okay, one block is nothing but a couple of so block, okay, which the patient has to take 4 to 5 steps, okay, to cross one block. Okay, that is what they meant, okay, in the article that is given. So if the person is able to take 5 steps, that comes under a conclusion of one block. Okay, next is there any illnesses? Okay, do you have more than 5 illnesses like BP, diabetes, vertigo, all those? Okay, so next is loss of weight. Have you lost more than 5% of your weight in the last 6 months? Okay, they were taking last 6 months. Okay, which says that frailty is not overnight thing, it's a gradual slowdown of symptoms, okay, of physiological function. Okay, so 3 is for 3 or greater is frailty, 1 or 2 is pre-frailty. Okay, so there is nothing like no and yes. Okay, so if the patient is having 1 or more, okay, so they consider as pre-frail. If the patient is having 3 or more, okay, they are considered as frailty. Okay, so next is fried phenotype, fried frailty phenotype. Okay, so this is very simple and commonly used in most of the hospitals. Okay, so they have given 5 listed down 5 characteristics. One is unintentional weight loss, the second one is muscle weakness, third one is slow walking speed, next one is self-reported exertion, and fifth one is low physical activity. These are the 5 symptoms which comes under fried frailty phenotype. Okay, so based on these 5 things, if the patient is having, if the patient meet 3 or more, they are considered as frail. Okay, if they are having less than 2, if they meet 1 and 2, they are considered risk for progression. This scale also will be similar to fried frailty phenotype. Okay, this is most commonly used, okay, in the clinical practice, and it is very simple to use. But here, whatever the thing mentioned here is, everything is based on the patient self-reported. Okay, can we rely completely on the patient who are aged above 85? We cannot exactly say. Okay, patient might have dementia but also act perfectly fine. Okay, so in those cases, we have to be, therapist has to be very much careful in order to gather all the history information. Okay, so this is one more, the 4-item essential frailty tool set. Okay, so this is very much convenient, which is latestly identified outcome measure. Okay, so here all the frailty tools are actually effective in predicting risk and predicting mortality. So this, when we are talking about 4-item essential frailty tool set, so it is actually done under 1 minute. Okay, so because being said that they considered the hemoglobin, the blood test, and serum albumin test are part of regular checkups. Okay, so when we are talking about this is international thing, so but when we are talking about the Indian population, they might not to do all this test on regular basis, blood test. Okay, so it is not regular for them. Okay, so this is 4 thing which gives all the physiological information. Okay, so the when we go back, so you can see all these 5. Okay, weight loss is there. Okay, that can be identified by your serum albumin. Okay, so next muscle weakness is there, that can be given by muscle weakness. The first test, physical mobility test, physical ability test, that is rising from the chair. Okay, so next is low walking speed is there, that also can be given by tested by first chair rise test. Okay, Next, exertion is there. Okay, that can be given by, that also can be tested by chair rising test. Okay, and exertion can also be ruled out by hemoglobin, by checking the hemoglobin levels. Okay, next is low physical activity, that can be checked by hemoglobin, serum albumin level, and this chair rise test. Okay, so all these tests are exactly marked in order to identify frailty. Okay, so and it is also can be done under 1 minute. Okay, if already have the hemoglobin test reports and albumin level test reports. Okay, so for the cognitive impairment, okay, so we have mini mental state examination, but it is very time consuming. So they have used mini cog test. Okay, so which is a 3-word recall that can be simply done by, simply understood rather than done. So it is simply understood by elderly age group of that category population. Okay, so here they have given markings like 0 point, 1 point, 2 point. Okay, the lesser the score, the least frail. The more the score, okay, the patient falls, the individual falls under most frailty category. Okay, so first is 5 chair rises, that has to be done under 15 seconds. Okay, if 5 chair rises that will be done greater than 5 seconds, that is scoring 1. Okay, if he is unable to do of various reasons, okay, that falls under 2. Okay, so if the patient by appearance might have physical strength, okay, but is not able to do, okay, maybe he's psychologically not stable, mentally not stable. Okay, because frailty is something, we have to look, healthy aging is something we have to see physical, mental, and social well-being. Okay, so he's mentally and socially is not so good. Okay, but still he falls under 2 points. Okay, so this is one more scale which is easily done. Okay, and frailty phenotype is another which we can rule out. So before prescribing exercise, we have to do a screen check. Okay, so whether this patient is good for someone's exercise program or not. Okay, so first one is cardiovascular. You have to check for cardiovascular risk, musculoskeletal issues. Okay, if the patient is having so and so reason, the patient cannot red flag for standing itself, we cannot teach them balance exercise, correct? So it is a known information. Okay, so to screen or to rule out and to plan a effective exercise program, safety consideration to be taken. Okay, next, while doing exercise as well, you have to monitor symptoms such as chest pain, dizziness, excessive fatigue. Okay, everything can be observed on patient, or in the form of patient reported outcome, we can come to a conclusion, and we can set exercise according to their tolerance level. Okay, so always we have to, so for any individual, okay, from children to adults to elderly, for apart from that, for frailty people also, so warm up, cool down, all these phases has to be done in order to prevent injury related, exercise related things, injuries. So next one is overcoming barriers to exercise. Okay, so common barriers, so will be fear of injury. Okay, what while doing exercise, what if I fall? Okay, that is the major thing for elderly age people to exercise. Okay, so even if a 60 years, 60 or less than 60 years age group also, if they are affected with stroke, okay, the main thing we will be doing, so moving out from the bed. Okay, the first thing they will have apart from the weakness is fear. Okay, we have to come over that. Okay, to untrain them, so it which is very much task for physiotherapists or any allied health science group professionals than the patient itself in India, when we are talking about India. Okay, so next, to solutions to all this, like lack of access or low confidence, all this will be, so we can plan programs at home based level. Okay, and we can the patient is not very much convenient with the therapist or any professional. Okay, caregiver involvement will be very much helpful for the patient. Okay, at the same time, telehealth coaching can be done. Okay, so always when for frailty people or any other elderly aged people, so exercise is tailored according to their needs and tolerance level. Okay, motivation and adherence to strategies. Okay, so always social support. Okay, so here, so when we are talking about adult, okay, or any teenager, okay, so exercising individually will be preferable. Okay, whereas for the elder it's not like that. They, most of the population, not all, most of the population will be like So you want to communicate. They feel like even if you sit with any of the older people around our homes, they wanted to say all the story throughout their journey happened. Okay, so that is how the patients will be there. That is how the older age the mindset will be there. Okay, at the same time, when we are making them as a team, like group therapy, okay, so it will be much more add-on points. Okay, they will, whatever the exercise plan for a 6 weeks or 8 weeks or 10 weeks, okay, they will be added to the program, okay, plan. Okay, so that will benefit both the therapist, okay, for the amount we are receiving, at the same time the patient. Okay, it is kind of positive reinforcements. Okay, at the same time we have to set goals, okay, very much minimal, that the patient or the family member can track. Okay, so we cannot set goals, okay, which cannot be seen. Okay, so because based on the goal setting only they are achieving, that will be a very much positive for the individual, so that they wanted to involve more in the following programs. Okay, next is policy and public health initiatives. So here World Health Organization Decade of Healthy Aging, okay, they have given a global initiative, okay, from the year 2020 to 2030. Okay, so here their main aim is like to promoting physical activity, okay, mainly in the elderly aged population. They wanted to make all the elderly aged people physically good enough to do their own activities. Okay, so because of this particular global initiative, okay, so many changes has been seen across the country, like building a community, all these elderly aged friendly parks or communities or senior aged homes. Okay, so they this is the logo they have given, and they have organized, so this is the done last year, okay, clinical consortium on healthy aging, okay, where they have created a 5 to 7 November, like a 3 days consortium regarding awareness creating on healthy aging population, to say and educate how physical activity will may reduce their dependence. Okay, so and educating them. Okay, so all these are taken initiatives taken by the government. Okay, some of the policies they have taken recently. So movement as medicine, okay, this exercise, so like physician they consider drug or medicine as, for us like physiotherapists, movement is medicine, that is exercise is medicine. Like, so it is a non-pharmacological intervention for any type of condition the patient is suffering, like pharmacology, sorry, like musculoskeletal, neurological, psychological, everything we have prescription. Okay, but in the form of exercise. Okay, so regular movement stimulates muscle protein synthesis, that is how the strength is being formed. Okay, and cardiovascular conditioning, the patient should be able to walk, okay, few steps more after taking the exercise program. And neuroplastic changes, which will help to sustain the post exercise effects for longer time. Okay, so at the same time movement helps to maintain mental health and social engagement. So apart from this, okay, some patients, elderly aged population might be feel shy to come to a physician, to come to a physiotherapist, or to come to go to any gym, or to go to, not gym, to go to any clinic or rehab setup to do exercise. Okay, in those population who falls under this category, we can modify and give them a list of activities and make actually a checklist. Okay, go for a walk, go to like gardening, okay, gardening or walk to shop, okay, which is out of traffic. Okay, we have to look at safety parameters as well at the same time, and do some amount of house chores. Okay, all this we can make a list. Okay, so based on the patient's ability. Okay, so on alternate days make a list. Okay, whatever activity, or it can be either hobby or work or whatever the previous the patient used to be doing. Okay, so all this you can make a list, checklist, and okay, you can ask the patient to mark whatever he has done. Okay, so that is helping him like positive inform. Okay, I have done so many things in the last 1 week. Okay, so like that. Okay, so it is giving feedback, at the same time he is getting engaged in various multiple house chores. So next is role of caregivers and family. Okay, so than therapist or than any healthcare professional, caregiver is someone. Okay, so he has both advantage and disadvantage. The patient is relying more on them. Okay, the patient, that sometimes the elderly population will rely more on them that if they don't like anything doing them, they might hit them also. Okay, that relationship will be so much that they depend on them. Okay, so at the same time, it is not only physically, okay, they can rely on them for doing all the activities of daily living, but also cognitively, but also mentally. Okay, there is some amount of bond, okay, some amount of engagement. They can talk, they can share their stories, all this, they will be active, right? Next one is exercise recommendation for frailty. Okay, this is balance, muscle, aerobic, and flexibility. Okay, so here I haven't mentioned, okay, the list of exercise, because so when we are talking about frailty, it is not set of exercise that improves the condition. Okay, so we have to tailor. Okay, but at the same time, depending on the patient's abilities, we have to try to include balance, muscle, aerobic fitness, and flexibility. Okay, so but the exercise what we are giving under those components is completely tailored according to the patient. Okay, so this, according to the article, muscle performance exercise, the strength or endurance can be given according 2 to 3 times per week, 8 to 10 exercises. Okay, this is the normal maximum amount of exercise. Okay, so it can be according to the patient's tolerance, can be reduced, or if the patient is good enough, we can advance from this range. Okay, so all this, we have no aerobic exercise, like why do we give? So it improves cardiovascular endurance. Okay, so it need not be like treadmill running or cycle ergometer. Okay, simple walking can do the job. So considering that, so the patients we are dealing, okay, the age group of the patients like 65 and above, they can do some amount of treadmill at low speed. Okay, so when we are talking about 85 years, no, so getting up from bed is their main aerobic activity. Okay, so according that, so in order to increase cardiorespiratory endurance in whatever ways possible, we can tailor the exercise. Next is resistance exercise. Okay, we can use the weights, resistant bands, or the bedside things which is safe for the patient. Okay, which is available at the home, can also be given. Okay, next for the balance exercise, okay, tai chi, single leg stance, which are little more complex, little more which has to be done under supervision, but known to be very much effective. Okay, next is flexibility exercise. So for elderly, talking about this age population, okay, simple joint range of motion to the available range, and beyond 5% beyond that itself is a flexibility exercise. Okay, these are the some articles which has given nicely about the set of exercise protocols to be done for elderly population. Okay, there is one more exercise which is very much effective for frailties, multi-component exercise program. So it is a combination of exercise, so they are including aerobic, resistance, balance, and flexibility, and said that it is more effective. It is actually a 12 week program throughout the year, so like 3 times in a week has to be done. Okay, so it addresses multiple frailty aspects simultaneously, like physical, mental, social, all those based on all those different things they have framed an exercise. Okay, which is showed to be effective to reduce frailty markers, that is the inflammation. So all those what we have studied, the oxidative stress, the hormonal things, so all those is shown to be reduced and improved in the mobility, in terms of mobility, strength, quality of life, all this. Okay, at the end of the session I'll show the different exercise. Okay, so these are other exercise which can be effective. One is COG, center of gravity training, multisensory training, posture strategy training, gait pattern training. So all these are balance exercise, okay, which has to be done with variations in terms of sensation, sensory feedback. Okay, in terms of strength, in terms of walk, in terms of speed, all this. Okay, so center of gravity training, the first thing is we have to divide them into 2 components. One is upper extremity, the second one is lower extremity. Okay, so we have to, the primary thing for the first 4 is, so you have to train, so like prerequisites. Okay, prerequisites, like you have to see whether there is enough strength in the upper extremity, lower extremity, and required range of motion is there or not. So if there is no range of motion, no strength, no sufficient endurance, then you have to train and then come to this multisensory or postal strategy training. Okay, these are nothing but, okay, so if the patient is able to take 4 to 5 steps, okay, we can vary that. Okay, take the 4 to 5 steps with varying in speed. Walk slowly, walk fast, okay, walk on top. Okay, you have to take 5 steps while walking to the therapist, okay, based on so and so conversation. Okay, like this you can give so many stimulation which has to be proven to be effective. At the same time, if he is walking on uneven, okay, walk on even surface. Okay, if he's walking on tiles, walk on mat. Okay, so like that sensation with simple things we can alter, and that is proven to be effective. Okay, next, strength and endurance training, as we discussed before, with the weights or therabands and whatever, or repeat simple repetitions of anatomical movements will do the job. Okay, so next is flexibility training. Okay, so and environmental modifications. Okay, so apart from that, we are going to study the prevention. Okay, prevention is nothing but, so whatever we are giving advice to other population, and whatever our parents or a senior person in the home giving to us, is all nothing but preventary methods. Okay, so first thing is educate the patient how to use the Ma'am, am I audible? Actually, currently
Yes.
stop. Okay.
Yes.
Okay, you have to educate, if the patient is having any assistant devices, you have to educate regarding that. Okay, how to change the position from sitting to standing, standing to sitting, while walking, all those. Okay, so you have to have a check on. Apart from that, regarding the hydration and nutrition status, so vitamin K, vitamin D, calcium supplements, all this has to be included in the patient's diet. Okay, you have to have a check on what are the medication the patient is having, if it is having hypertension or other diabetic related conditions. Okay, so because that will lead to falls at the same sometimes. Okay, so regular examination has to be done. Next is environmental modification. So as we discussed before, proper lighting in the rooms, hallways, switches, which has to be located near the entrance, which is easily accessible to the patient. Okay, so if in case of current off, you can use the flashlights. Okay, which has to be kept near the patient. Okay, not somewhere else. And the furniture has to be organized in a way, so it has to be same for long years, so that the patient will have clear idea how to go. Okay, so if I go this way, I won't get hit. Okay, that memory, that neural mapping has to happen only because of habit. Okay, that has to be done over long time. If the patient is practicing the same way, that will happen. Okay, this is one simple thing. Okay, but is very much effective. Okay, so next, providing non-skid rugs or carpets for the slippery floors, which also prevent from falls. Okay, so in case of toiletries, okay, if the patient the Indian toilet, it will be very much difficult. Okay, even Western, sometimes if it is low in height, we have to elevate it using different toilet seats or non-skid, all those. Okay, so, or toilet safety frame, all this has to be modified. At the same time, handrails has to be organized. If there is a stairs, if there is a ramp, if there is a walkway to the wall in the bathrooms, okay, everything we have to make sure environmentally he is good enough to move around his home. Okay, so all this can be done. So use of various gadgets in case of emergency can also be done. Next is rehabilitation. So the main thing is we should not only focus on physically, but also we have to cognitively, psychologically, and socially we have to engage the patient. Okay, at the same time we have to keep in mind the medical status, okay, and cognitive function of an individual. These are some of the approaches which are proven to be effective, like Otago exercise program. This is completely a home-based exercise where they're including all the components, strength, balance, and physical activity, and shown to be effective. Next is Tai Chi. So Tai Chi is another exercise which is designed for balance. Okay, right? So that is also shown to be effective. Next is bingo size. Okay, in the UK they have designed a bingo size. This is one of a game, especially for senior citizens. Okay, so while moving, okay, at the same time they are getting, there is a moving component, which means component focusing on physical ability. At the same time there is a component for educating. Okay, so they are empowering them with the education regarding the importance of physical activity and how to stay active. Okay, so all this in the game they have introduced. Okay, and which is a combination of other exercise. They have included one physical strength, and that is flexibility, one more is balance. Okay, so each time you do a game you have to go and do one exercise and come back and sit. Okay, so that is how the next time you do the game, okay, you have to go learn something about so and so whatever that comes in the chat, and then you learn something about the your health. Okay, so that is how the senior for seniors they have designed a program. Next is capable community aging in place and advancing better living for elders. And one more is SAIL. Okay, stay active and independent for life. Okay, this is evidence-based group of programs. Okay, so they are like a 10 weeks program. Okay, so they have specially taken individuals 65 and 65 years and older. Okay, so it is institution based. Okay, so they are doing a program along with group therapy and certain exercise elements which are shown to be effective in terms of strength, balance, and fitness. Okay, these are certain community-based programs, okay, which are particularly present in India, like Age Well Foundation, Silver Space, Ashley, like Association for Senior Living Citizens. Okay, these are some NGOs and some are not. Okay, some are these elderly friendly clubs. Okay, which we can go and join for various things. Okay, so they will enhance, they will enrich various activities regarding hobbies, painting, dancing, aerobics, so education. So if the patient has interest in teaching also, they will encourage that. Okay, so whatever the patient has interested prior to his active lifestyle, so they will promote that as well. Okay, these are very good foundation that is available. Okay, so whoever don't know can make use of it. Okay, so there are certain government initiatives like NPHC. Okay, so these also commitments to promote the health and well-being for older adults. So these are my references. Thank you.
Dr. Kavita?
Yes, ma'am.
Yeah.
There is only one question is there, ma'am. Why women are more common to frailty, ma'am?
Women are more frail to this. Okay,
With-
mostly when we talk about the physiological mechanism, the amount of muscle mass and in terms of strength is already less. Physiologically itself, it is less when compared to men. Okay, over the time of working, over the time of repetitive activities, over the time of obesity, the adipocytes and all the accumulation. So all this leading to more amount of wear and tear changes. Okay, and at the same time there is a hormonal thing I have talked about. Okay, so the amount of estrogen, the amount of progesterone, okay, the amount of growth hormone, this is much more because of menopause, menarche and all. So furthermore reduced when compared to men. Okay, so that is how the muscle cells, the apoptosis is greater. The great amount of this muscle proteins are getting involved in the bloodstream. Okay, so that is how it is related to women are getting more affected when compared to the men
Oh, okay, ma'am.
in terms of hormones, in terms of oxidative stress, in terms of adipocytes accumulation, in terms of menarche. All these are the factors that is making women more frail to when compared to men.
Yes, ma'am. Thank you, ma'am. Uh, okay, ma'am. We can end the session, ma'am. I would like to I would like to extend my heartfelt gratitude to each and every one of you making this fifth day webinar a grand success. I would also like to express my sincere appreciation to our speaker for sharing their expertise and insights. To our organizing team, thank you for your tireless efforts and dedication. Let's continue to learn, grow, and make a positive impact together. Thank you once again. Thank you, ma'am.
Thank you, ma'am.
Okay.
Thank you.
Thank you so much, Dr. Lakshmi and Dr. Kavita. I think I'll end the session now. Is it okay?